Today, I want to talk about something that's really just near and dear to my heart and is the reason that I have the children that I have. And I am so grateful for this type of medicine that has been founded and helped me, like I said, to achieve my pregnancies that my husband and I have been able to achieve. And without this, we would have had a story of infertility. Without this, my husband and I would have had a story of infertility. So, what am I talking about? I'm talking about something called NaproTechnology. This is what this video is going to be about today. I'm going to tell you all the nitty-gritty details about what NaproTechnology is, how it works, how to find a doctor that practices it, and so on. Whether you are watching me or watching this video and you've been struggling to conceive for years, or maybe you just got married and you're starting to think about having a family, or maybe you are a single woman and you just want to be proactive about your health so that one day when you do get married, you are already one step ahead. In past videos, I have briefly mentioned NaproTechnology as kind of an answer to what should we do if birth control isn't the answer to women's health? If women are struggling with conceiving, or no matter where you're at in state of life, whether you're trying to conceive or not, having reproductive issues that are destroying your quality of life, what is the answer? And that is NaproTechnology, which is what we're going to be talking about today. So as a little brief introduction as to who I am and why I know at least a little bit about NaproTechnology. So my name is Haley, and I work at an OBGYN clinic where I teach women and couples how to chart their fertility cycles so that they can either achieve or avoid pregnancy wherever state of life they're in and what their family planning decision is at that point in time. And also, too, so that they can maintain their health and know exactly where they're at in their cycle and really have a sense of empowerment in knowing about their fertility. So I am super passionate about women's health and about getting women and couples especially just more knowledgeable about what is going on with the woman's body, why her fertility is so beautifully created and made and just so beautifully works. And B, if it's not working as it should, how do we fix that? How do we change that? How do we get it so that we can find the most optimal health for that woman and for her marriage, right? And just for her overall relationships as well. I first even really heard about charting your cycles, NaproTechnology, which, by the way, I realize I haven't mentioned this yet. It stands for Natural Procreative Technology. So that's NaproTechnology. That's how it's talked about. So anyways, I really didn't know a whole lot about this growing up, and I always had irregular cycles. And when I was about 18, 19 years old is when I started to recognize, okay, there's something wrong, something unusual. I need to kind of get this looked at. And so I found a doctor in my area actually that practiced NaproTechnology and just did medicine with teaching women how to chart their cycles, because you can see so much about a woman's hormones, about how her fertility is going on even a day-to-day or month-to-month basis. You can see so much on a chart. And so I started going to this doctor who taught me how to chart. And then by teaching me how to chart, she was able to diagnose me with polycystic ovarian syndrome, or PCOS. And so I spent my young 20s really diving into this, finding health, finding the right medications, diets, those types of things to find optimal health. And at this time as well, I met my husband. And so when we got married, we were open to life. And so we wanted to have children right away. And praise be to God, within 7 months, we were able to conceive our first son, who is right over there drawing with chalk, if you can hear that. And I'm so grateful that I started that journey young, because when we got married, although it took 7 months, I know so many people have a much different story than we do. And it did take a few years after my diagnosis to figure out just how to get me the healthiest that I can be. And it was through charting and through using or seeing a doctor who is trained in NaproTechnology, natural procreative technology, who is able to truly help me and heal me, so that when I did get married, my body was at an optimal place, or at least as optimal as possible, to be able to conceive children. And so I know not everybody has that story, and I am very blessed to have that story, but I share it because I want to give you hope. I want to give you hope that there is another answer, and that your suffering or the struggles that you've been through, whether it's trying to conceive or just really having a poor quality of life because every month you are down with cramps and you just can't even move. Like, there are women who are very much suffering because of something going on that's wrong with their reproductive system, with their fertility. So this is where NaproTechnology starts. So let me kind of back up a little bit and talk about what it even is and how to find somebody who practices it, why you would even want to go this route to, like I said, either achieve a pregnancy or just become healthy. So NaproTechnology is a women's health science that looks at the underlying root as to why a woman might be experiencing X, Y, or Z. So rather than going to a doctor and saying, I have irregular cycles, and being put on birth control to regulate those cycles, which it doesn't. And I have another video that I'll link to kind of explain that. But what a NaproTechnology trained doctor is going to do, if you were to go, just for example, and say, to a doctor and say, I have irregular cycles, what they're going to do is pair you up with somebody who can teach you how to chart. And that's probably going to be charting in the Creighton method. So there are plenty of methods out there that will help women learn and couples learn how to chart their cycles. But NaproTechnology is very closely intertwined with the Creighton method of charting your cycle. And the reason why is because it was actually founded by the same guy. So Dr. Thomas Hilgers is the guy who, a very, very brilliant doctor who lives in Nebraska. He's the one who founded NaproTechnology and the Creighton model system, along with a team of very, very smart men and women. And so through his research, he was able to develop a system of charting a woman's cycle to be able to see different biomarkers or different things that you can see on a chart to be able to determine what's going right and what's going wrong. So just for examples, looking at a chart, we can see low progesterone, we can see things like PCOS even, we can see things like endometriosis, we can see so many different things just on a chart itself. And now that chart does need to be followed up with blood work and ultrasounds and different tests and things, but that's a very good starting point to be able to figure out what's kind of going on. Are you even ovulating? That can be seen on a chart too, which is the most important thing. That is the main event of the woman's fertility cycle, is ovulation. So if that's not happening, there's definitely something going on that's wrong. And so a NaproTechnology doctor is going to have the woman, usually, is going to start with the woman learning how to chart her cycles. And after a few months of charting, at that point, we'll be able to have enough data for the doctor to say, okay, here's kind of the next step. Here's what I'm seeing, and here's where we can go from there. And so my job is, my official title is a fertility care practitioner. And so what I do is I am that first kind of line of defense in teaching women how to chart. No, I'm not a doctor by any means. I don't prescribe anything, but what I do is I teach women and couples how to chart their cycles so that they can start this journey of really, truly understanding what's going on with their fertility. And then from there, the couple or the woman will work with a medical consultant, so a NaproTechnology medical consultant. And working with a medical consultant can be an MD, it can be a PA, it could be a nurse practitioner, it could even be a midwife. People who are even pharmacists actually can be medical consultants. These are people that are trained in knowing how to use NaproTechnology to diagnose and treat women with whatever reproductive situation or issues that might be going on. So I am not trained in diagnosing or anything like that. I work with doctors, so I know about their protocol, and I kind of am, like I said, the first line of defense in being able to see kind of what's going on. And then I refer to the doctor, and the doctor does the rest of the work, which is great. I'm very grateful for very good doctors. So NaproTechnology uses medical and surgical procedures to treat women. So some women don't need to go the surgery route. They just need a different medication, or they need progesterone supplementation, or they need X, Y, or Z, depending on what the situation is. And then some women do need surgery to correct what is going on. For an example, endometriosis. Endometriosis is something that we can see pretty clearly on a chart, but the only way to truly diagnose and treat endometriosis is by surgery. It is by getting rid of every single cell of endometriosis in the woman's body. That is how it is treated. So that is going to be a surgical procedure. It is very effective. A lot of women, and this is of course just an example, but a lot of women who have endometriosis get put on the pill so that it can stop the spread of the endometriosis, but it doesn't fix the problem. The second they get off the pill, it's going to start growing again. And no, you're not going to be on the pill for your entire life. What if you want to have children one day? It's not actually treating the problem. All it's doing is masking the symptoms or stopping the growth, but it's not taking out the endometriosis. Again, just for an example. So these NaproTechnology surgeons are trained in things like treating endometriosis or surgically treating whatever it might be. So NaproTechnology has different tiers or different levels for the amount of care that a woman needs to find that optimal health. So I am so grateful for the doctors and the researchers who have dedicated their lives to building this new medical health science to really help treat women at the core, at the root of what is going on, so that she may live the most optimal and healthy life that she can. And I'm also super blessed to be able to know personally NaproTechnology doctors and surgeons, to be able to work with them and learn from them. I have learned so much just working in the same place as them, and I've seen them heal women, treat women. Like I said, I myself have experienced the same thing. So if you are in a struggle to conceive, please consider this. Consider this route of NaproTechnology. It is healing the root, right? It's not going against your body by any way. It's actually going with your body, trying to bring it to its natural health, the way that our bodies were meant to work, so that conception can occur. Or if conception isn't the goal for you, just so that you can have the most healthy body and healthy reproductive system that you can. It's not trying to cut corners. It's not trying to force conception to happen from an artificial method. It is working with your body, healing the root, so that you can have the most optimal health possible, and hopefully one day are able to achieve that pregnancy, which is the goal, right? The gift. So for those of you that do want to learn more about NaproTechnology, I'm going to put a bunch of links in the description with just different articles and websites that you are welcome to check out that talk about NaproTechnology. You can learn more about it and learn more about the doctors who practice it and who research it and who build this method of science. I will also link below a link to the St. Paul VI Institute. This is where Dr. Hilders, who I talked about, who founded the Creighton model system of charting and founded NaproTechnology, this is where all of that research is done. The Institute is based in Omaha, Nebraska, and he is still there, fully dedicated to his work in continuing research, along with a whole team of doctors and researchers. So I will link the website to them down below as well. They always have people answering phone calls to answer questions, or just for people that are interested in learning more about it or interested in pursuing this method of science to conceive children and grow their family. You are always welcome to reach out to them as well. I will also put a link for FertilityCare.org. This is a website you can go to where you can just plug in your location, either zip code or city, and it'll pop up results like practitioners, which is what I am, where we teach women and couples how to chart. It'll also show your nearest medical consultant that you can see if you do need diagnosis and treatment, and then also to where the nearest surgeons are near you, which can help if that ends up being the case for you. So I will link that down below as well. And then lastly, along with all the links to websites and everything, I also wanted to talk about this book right here. This is a book all about NaproTechnology, just what it is, how it works, how it was founded, all the research behind it. And what actually, I'll turn around so you can see, is NaproTechnology Revolution. This book is so helpful for just the lay person to understand NaproTechnology. So it is kind of in the format of a textbook, but it just has such good information about why charting would help with medicine, why you can see different things on a chart, what a chart can show, and how a doctor may go about treating that. It just has such good information. And like I said, it's really tangible and easy for the layperson to read. So you do not have to be medically trained by any means to read this book and to really process it and understand it. So this is where I would go to next if you've done all the research online and you're wanting to sink in more into this idea of NaproTechnology and wanting to learn more about it. So I recommend this book. I'll also put the link for it down below. It is produced by the St. Paul VI Institute, which again, like I said, is in Omaha, Nebraska. I don't know if they're selling this on their website anymore, but I actually got this used on Amazon. So again, whatever is linked below is what's available. So I'll do that research for you and I'll find it. But this is a really good resource too. So the NaproTechnology Revolution is what this is called. And it was actually written by Dr. Thomas Hildreth, who's the guy, like I said, I keep talking about him, that founded all of this. And very smart, very just brilliant man. So that is my spiel on NaproTechnology. I hope that it at least convinced you to look into it a little bit more. The purpose of what I do and my mission is wanting to help women find optimal health and wanting them to get answers to the questions that are not being answered for them by the mainstream doctors or the OBGYN that they're currently seeing. Like maybe they are experiencing a whole lot of pain every time they have a period. Maybe they never have a period and you're like, what is going on here? Maybe, I don't know, whatever the situation is, maybe you're having trouble conceiving. This is where I found my answers, and this is where I am very confident that you will find your answers too. If you have any further questions about it at all, please feel free to put questions in the comments, or also my email is linked in my bio. So you are welcome to email me with any questions or further inquiries that you might have. Thank you so much for sticking around with me today, and I will see you again next week.